Welcome to my YouTube channel. So in this video we will see some of the basic and important questions for the upcoming staff nurse recruitment examinations. So the first question is, if the patient with mania, so the patient is having the mania, so he states that rock, clock, clock and mock. So it is a kind of mannerism words, okay, some dialogues, repeated words, okay, related, like a same pronunciation, like that. If the patient is speaking like rock, clock, lock and mock, so the words documents this verbal expression as. So what is the meaning of this kind of words when the patient is states that with the mania condition? Option A, flight of ideas. Option B, word salad. Option C, clang association. Option D, euphoria. So the right one is option C, clang association. So in this condition, so in this kind of clinical feature, there is nothing relation, okay, so there is nothing relation between the words, but simply they are saying like that. So this kind of verbal expression is known as the clang association. So the next one is a omega sign. So omega sign is seen in which condition? Option A, depression. Option B, schizophrenia. Option C, mania. Option D, alcoholism. So this kind of omega sign seen in which condition? The right one is depression. So when the person in the severe depression, so the forehead we can observe this kind of foldings. So this kind of foldings, this is the nose and this is the lips and eyes. So this is the forehead. So omega sign we can observe here. So in the depression patient, the person will have the omega sign. The right one is option A, depression. The next question is a sudden and transient episode of muscle weakness accompanied by conscious awareness which is precipitated or triggered by emotions as laughing and crying is known as. So the patient is having sudden laughing or crying with the conscious, with the mind working, okay, and which is connected by the emotions. For example, when the person is unknowingly crying or laughing with the depressed or stress situation, okay, so there is no reason for laughing, but due to the over stress, okay, ఓవర్ స్ట్రెస్ పని ఎప్పుడైనా ఎక్కువ అయిపోయినప్పుడు పిచ్చిలేసి మనము ఒక నవ్వుతాం కదా, సో దాన్ని ఏమంటారు? సో ఆప్షన్ ఏ క్యాటటోనియా, ఆప్షన్ బి cataplexy, option C neologism, option D delirium. So దాన్ని option B cataplexy. So cataplexy is a condition with the sudden laughing and crying with the awareness, okay, consciously the person is laughing and crying. The right one is option B. The next one is sleepwalking is called. Option A, somnambulism. Option B, insomnia. Option C, narcolepsy. Option D, all of the above. So the right one is option A, somnambulism. So somnambulism is a medical term for sleepwalking. The next one is most vivid dreams occur during which type of sleep? Okay, dreams, we will get the dreams mostly in the mornings, okay, early morning, 4 o'clock, 5 o'clock. Some people are saying that if you get the dream at early morning, it will become real. Okay, so which type of sleep we can get the vivid dreams? Option A, random eye movement sleep. Option B, rapid eye movement sleep. Option C, non rapid eye movement sleep. Option D, all of the above. All of this in any of the, I mean, all type of sleep we can get the dreams. So the right one is option A, random eye movement sleep. For example, by yourself you can understand. Okay, when you are in a deep sleep, okay, you will not get the dreams. But when you are in subconscious nothing but, for example, you are sleeping in the room and a door is open. So in the mind, your door is open, the brain is telling you that your door is open, you be conscious, like that. So that is known as the random eye movement sleep. So in this sleep only we can get the dreams. The next one is, which of the following is long-term effect of medical complication of alcoholism and can be also due to which of the vitamin deficiency? Option A, depression by thiamine. Option B, delirium tremors with calcium. Paranoia with zinc loss. Korsakoff psychosis by thiamine. So the right one is option D, Korsakoff psychosis. So Korsakoff psychosis is alcohol, okay, and due to the deficiency of thiamine. So due to the excessive taking of alcohol, there is a less deficiency will be taking place of the thiamine. So if you replace the thiamine, the Korsakoff psychosis will be disappeared. The next one is a heroin is a form of. So this is not a heroin. Heroin. Okay, it is a type of drugs. What you see in the films, that type of drugs. So the heroin is a form of. Option A, tobacco. Option B, poppy. Option C, datura. Option C, cannabis. So here you can see the picture. So you may get the question like this. Identify the picture below shown. So you have to give the correct answer, that is poppy. So heroin, it is a form of poppy chemical. So this type of fruits you can see here. So when you cut, when you cut like this here, you will get the white creamy substance. So that is known as the poppy. So the next one is a, who named schizophrenia? Option A, William Tukey. Option B, Eugene Bleuer. Option C, Carl Manninger. Option D, John Weber. The right one is option B, Eugene. So he is the person has given the name schizophrenia. The next point is the main character of difference with neurosis and psychosis. So what is the main difference between the neurosis and psychosis? The answer is the insight. So in the case of neurosis, the person will have some insight, what I am doing, why I am doing like this, who are they, what they are going to do with me. Okay, some kind of conscious will be there. But in the case of psychosis, nothing will be there. Okay, all the mind is blank. He don't know what he is doing, he don't know what he is eating, he don't know whether where he is going. Okay, whether he is live or death also the person will doesn't find out. That is inside. The next funny question is the a wife after completing her stressful work. Okay, nowadays wives also working in the office with stressful, okay, in the office. So after completing office, she reached to the home. Okay, so she reached to the home. She is unnecessary shouting on her husband. Why? Because already husband reached to the home. Okay, he is in the home only. So after came here, the wife also came. Okay, after that what happened? She is unnecessary shouting on her husband. So if you are in this situation, so you can understand the psychology of the human being. If you are in this situation, what you will understand? Options are repression, displacement, rationalization, conversion. So some of the people may experience this kind of okay in your homes. So you can give the correct answer, that is all the husbands will give the displacement. So this kind of future we can see in the case of displacement. Why? Because when the person is stressed in the office, okay, so in the office the manager, so manager has scolded employee. So what he will do, reversely he cannot scold the manager, but his all the frustration will be taking in the home. Okay, whoever present in the home, for example children's uh, wife or the husband or children's, I mean elder peoples, whoever, even in the animals also. Nowadays they are showing their frustration on animals. So the right one is option B, displacement. The next one is a IV fluid administration is contraindicated in. So in which condition IV fluid administration is contraindicated? Option A, hypovolemic shock. Option B, congestive heart failure. Option C, septic shock. Option D, pleural effusion. So the right one is option B. So in the case of congestive heart failure, already there is a overload of blood in the heart. Okay. So due to the overload, there is a congestive heart failure has happened. Again, if you are giving the IV fluid administration, what will happen? It will increase more congestion. So you have to reduce the congestion in the heart. So IV fluids are contraindicated in the case of congestive heart failure. But in the case of hypovolemic shock, we can give, septic shock, we can give, pleural effusion, we can give. Why? Because there is no relation between pleural effusion and IV fluids. The next one is patient biodata is present in. Patient biodata is present in which of the form? Option A, cardex. Option B, nurses notes. Option C, nursing care plan. Option D, all of the above. So where we can find out the patient biodata? That is option A, cardex. So in the cardex, what are all the things will be present? Name, age, sex, and religion, medications. Okay, all the things will be present in the cardex. So nurses notes is about the nursing care. Nursing care plan is the nursing interventions. All of the above is wrong. This is wrong. This is wrong. So the right one is option A. The next question is a basal cell carcinoma develops from. So basal cell carcinoma develops from option A bone marrow, option B lymphatic tissue, option C glandular tissue, option D blood vessels. The right one is option C glandular tissue. So basal cell carcinoma develops from the glandular tissues. What is the route of administration of MMR? MMR vaccine. Subcutaneous, nasal, oral, intramuscular. The right one is option A, subcutaneous. So subcutaneous, measles, mumps and rubella we will give in the subcutaneous route. By nasal a route is the influenza. Oral is the polio. Intramuscular is the pentavalent. Okay. So the right one is option A. The next one is a pH of vagina becomes acidic. Okay, pH of vagina is becomes acidic due to the presence of Bartholin glands, sebaceous glands, Dodelian bacilli, E. coli. The right one is option C, Dodelian bacilli. Due to the presence of this kind of bacillus, so it will convert the vaginal secretions from alkaline to acidic. Okay. The next one is Ramsay scale is used for the assessment of option A pain, level of conscious, arousal, sedation. So which is the right answer? That is sedation. So when you give the drug, any sedative drugs to the patient, by using Ramsay scale, you can assess the level of sedation. Okay, Ramsay scale is used for the sedation. That is Mattu. Final question is rigor mortis starts in. So when the person is died, so he is the person has died. So what will happen? Immediately after the death, what will happen? So after death of the patient, the changes will be taking place. That is, first one is the algar, second one is the liver, third one is the rigor. So what is the question here? Rigor mortis starts in liver, brain, heart and lungs. So after death of the patient, the algar mortis starts by decreasing of temperature. Okay, by decreasing of temperature, algar mortis will be start, and the liver mortis is nothing but discoloration. Okay, and finally rigor mortis is nothing but stiffness. So the stiffness of body is starts from heart. Okay, the right answer is the heart. So the rigor mortis is start from the heart. The right one is option C.